Back to the full view. Earlier we looked at the bad news, the bloodshed in the Western Cape, taxi violence there. The good news, South African taxi drivers are receiving COVID-19 vaccination jabs at their own vaccination centres. Now these centres were established by SABC to help the drivers save time and still reach their daily load. Maroba Maduma is the Group Communications Executive at SABC. He joins us now. Mr. Maduma, thank you very much. Firstly, how's it going?
Good evening, Francis. Thank you very much for having me, and good evening to my fellow South Africans on this very cold Friday, July evening.
So how's the vaccination drive going? When did it start? How many taxi drivers have benefited thus far?
So we started actually vaccinating just over a month ago. We've been very happy, but we could do with a lot more people coming in. We've had just over 3,200 actually as of today industry members that are vaccinated. Just to clarify, this is not just taxi drivers. Obviously the drivers are very important, but the taxi rank ecosystem also has taxi queue marshals, rank marshals. Anybody that is involved in the taxi industry is invited to come to our vaccination center here in Midrand for them to get vaccinated, because obviously they deal with people and they see quite a lot of South Africans coming in through these ranks. So as long as you're in the Gauteng area or anywhere around, actually, if you can make it to our vaccination center, you're please very much invited.
Okay, so of course this is very important. So is it only Midrand? Is it only for taxi drivers in Gauteng?
At the moment, yes, we do. The center is in Midrand. It's a collaboration between us, a partnership between ourselves, Department of Health, as well as Kaelo, who've opened up a world-class center here in Midrand. It's on 16th Road in Rankies Park, just next to our SABC offices. At current presence, yes, it's in Midrand. We don't know yet whether will be able to roll out across the country, but for now we invite everyone in Gauteng. Please.
Yeah. Would that be the hope, that you can go to other provinces?
Dependent on how it goes, yes. At the moment, we haven't looked at any other places around the country. There's quite a lot of vaccination centers around the country, as you know. We've focused right now on the Midrand area. It's been a long road for us to even get to where we are. We've been advocating for the taxi industry to be considered as an essential service provider, actually, through the SABC Foundation, working with Santaco and the NTA since level 5 last year. So the Midrand Vaccination Center is a big win. Yeah. And should we be able to, we will communicate, we will try and get other centers up if we can.
So what is the difference? Say you're a 40-year-old taxi driver. You are now eligible to go to any center. What's the specific pool? What do you offer at the SABC Vaccination Center?
So, the taxi operator is a very quick, on-the-road, I need to always be moving entrepreneur. We call them taxipreneurs, actually. The idea of having to wait in long lines while you're waiting with the general public is something that might be a deterrent to a taxi operator or somebody who's working in a taxi environment. What our Midrand Operations Center and Vaccination Center offers them is a place where only the operators are being given. So it's a world-class service. You've got professional nurses that are being provided to us, and it's a quick, efficient system that's basically put together specifically for the taxi operators. So what's in it for them is basically we want them to vaccinate. I mean, nobody's making money out of it. We just want them to be safe, and we want the commuters to be safe. We want their families to be safe. But at the end of the day, we know that time is of the essence for any businessman, and a taxi operator is a businessman. So what we're trying to do is get them a place where they can go that's dedicated to them, where they can get in, get vaccinated, be safe, and get out.
Yeah, and sure, I mean, essentially government is paying for everybody's vaccination, but this must be a logistical issue. What's in it for SABC? So you are a partner to the taxi industry, offering finance and things like that. So why are you venturing into the health domain?
Well, no one wants to see South Africans die. I mean, you laughed when I said my fellow South Africans. We all want to get out of this healthy. We've been in partnership with the taxi industry for the longest time, and through our SABC Foundation, since the beginning of COVID, we've gone out to offer PPE to the industry because their safety is our concern. They are our primary partners in this. So there's nothing really in it for us except for the industry to be safe, for the South African commuters to be safe. At the end of the day, we all have to work together, whether it's private sector, government, or anyone else. We know we need to vaccinate, and we have a very good relationship with the industry. We're able to speak to the industry through our teams to educate and to ensure that all these myths that we hear about your hand will be magnetic if you vaccinate. I vaccinated myself and I haven't got any magnetism in my hand. So what we do is we play a role where we are good partner to the industry and government, where we just put them together and we make sure that everybody understands what this is about and they can come there and...
Well, can you tell us, I mean, taxi drivers could be real advocates for vaccines and kind of lead the way. Is there enthusiasm or is there reluctance amongst the operators?
We started out quite slow, but also I think the word hadn't gotten out yet that we were open. But there's quite a lot of enthusiasm. We're doing quite a lot of vaccinations per day. And as the word goes out, as the education that we're doing through our teams, whether it be through messaging to our customers who then spread the word of mouth, or through our corporate affairs team and our executive there, Matsedikanye Muswani, who's got very good relationships with the industry executives, we've been managing to get more and more people to come. What I can tell you is the industry, just like everybody else, is very excited and very wanting to be safe. None of us want to be sick. So we've seen guys coming in there. There's quite a bit of excitement, but also hesitance. You know, guys want to know, I mean, is it safe? Am I gonna lose my libido? Excuse me. There's questions like that come up because of all these misinformations that have been put out there. But we're able to at least give them the comfort and the information. And then the more people come in and get the vaccinations and get informed, what we've seen is more and more people are then coming in. The word of mouth is spreading. The industry in the Gauteng area is jumping at the opportunity.
Mr. Maduma, finally, because you do say SA Taxi wants to look at the bigger picture, can you comment on what's going on in the Western Cape? And you've got a foundation, you want these communities to do well, but there's this extreme bloodshed.
It's very unfortunate, and obviously we stand behind Santako and NTA and as the mother bodies who have said that they want assistance. They are unfortunately there are some people who are trying to make life very difficult for the normal everyday taxipreneur, and the normal everyday businessman wants the business to continue. So we obviously don't speak on behalf of Santako. We are a service provider to the industry. But just like every other South African and every other businessman, we feel for those that want to be on the road, who want to assist people to just get to work and back.
All right, thank you very much. Maroba Maduma, Group Communications Executive at SA Taxi.